my beloved lecturer, Sir Faris Ahmad. My name is Muhammad Shafiq Aikal bin Osman. My metric number is 2020-X71702. Today, I will talk about splinting. A splint is a piece of medical equipment used to keep an injured body part from moving and to protect it from any further damage. Splinting is often used to stabilize a broken bone while the injured person is taken to the hospital. For more advanced treatment, it can also be used if you have a severe strain or sprain in one of your limbs. Placed properly, a rigid splint will help ease the pain of an injury by making sure that the wounded area doesn't move. The first thing you will need when making a splint is something rigid to stabilize the fracture. Medical teams have their own splinting equipment, but if you do not have it, the items you can use to make homemade splinting include a roll-up newspaper, a handy stick, a board or a plank, or a roll-up towel. If you're using something with sharp edge or something that might cause splinters, such as a stick or a board, be sure to pad it well by wrapping it in clothes. Proper padding can also help reduce additional pressure on the injury. You also need something to fasten the homemade splint in place, such as shoelaces, belt, ropes, and strips of clothes will work. Medical tape can also be used if you have it. Try not to place commercial tape, such as duct tape, directly against a person's skin. Now, I will show you how to do a splinting on a broken leg. Now, I will show you how to do splinting for a broken leg. So, you need a homemade splint, which will be this wood. You need the roller bandage, and also you need the first aid kit. So, the first step is you need to attend to any bleeding. Attend to bleeding, if any, before you attempt to place the splint. You can stop the bleeding by putting pressure directly on the wound. But if there's no bleeding, then you can apply padding. So this is a gauze bandage. Apply a bandage. Don't try to move the body part that need to be splinted by trying to realign a misshapen body part or broken bone. You may accidentally cause more damage. Alright, after you apply the padding, place the splint. Carefully place the homemade splint so that it rests on the joint above the injury and the joint below. Avoid placing ties directly over the injured area. You should fasten the splint tightly enough to hold the body part still, but not so tightly that the ties will cut off the person's circulation. Then, use the roller bandage to do the bandaging. Alright, so after you've done the splinting, watch for the sign of decreased blood circulation or shock. You should check the areas around it every few minutes for sign of decreased blood circulation. If the extremities begin to appear pale, swollen, or tingled with blue, loosen the ties that are holding the splint. Post-accident swelling can make the splint too tight. While checking for tightness, also feel for a pulse. If it's pain, loosen the ties. If the injured person complains that the splint is causing pain, try loosening the ties a little. Then check that no ties were placed directly over an injury. If these measures don't help and the person is still feeling pain from the splint, you should remove it. The injured person may be experiencing shock, which might include them feeling pain or taking only short, rapid breaths. In this case, try to lay them down without affecting the injured body part. If possible, you should elevate their leg and position their head slightly below heart level. Lastly, you need to seek medical help. After you apply the splint and the injured body part is no longer able to move, call 999, our local emergency services. Or you can also take the casualty to the nearest urgent care clinic or emergency room. So that's how you do the splinting. You should seek immediate medical help should any of the following conditions occur. First, bone protruding through the skin. Second, an open wound at the injured site. Third, loss of pulse at the injured site. Next is loss of sensation in the injured limb, fingers or toes that have turned blue and lost sensation. Lastly, a feeling of warmth around the injured site. For the conclusion, when faced with an emergency injury, your first action should be arranging proper medical attention for the injured person while waiting for qualified help or to assist with transportation. Homemade splint can be effective first aid. You must, however, carefully follow the instruction so that your splinting doesn't make the injury worse. So that's it for today. I hope you guys enjoyed and understand what I'm trying to share with you guys today. That's all from me. Thank you. Assalamualaikum. Have a nice day.
Aku fahami mengapa tidak berhenti engkau menguji. Kenang kau sayang, kenang kau cinta. Aku dan agaku sayang.